Alors, last but not least, Monsieur Wellauer, je vous en prie.
Bon, j'aimerais d'abord remercier Monsieur de Montbrial pour cette invitation et pour pouvoir représenter le secteur privé ici. Pour mon intervention, je vais passer de la langue de Molière à la langue universelle, l'anglais. Speaking about health and healthcare, today this is largely a matter of the sovereign state. The question has been asked, how can we improve the governance that we have today? Should we strive for a more formal and centralized global governance? Or should the current, more fluent cooperation among states be reinforced? I suggest that before answering these questions, we need to understand the true performance of the current system, and in order to do that, we should develop common standards common metrics, so we can measure the true outcome of our system of today. Therefore, I'd like to first quickly review the performance of our current system, then address 3 common myths that are frequently put forward, and then finish off with a few questions and a few comments for your consideration. If we look at the objectives of a good healthcare system, there are 3. Improve the health outcomes, increase the satisfaction of the patients, and protect the individual against financial risk. So, if we look back, how well have we done? On the face of it, we have done quite well. Life expectancy has more than doubled over the last 100 years. In 1900, it was 31 years. In 2005, it has increased to 66 years. These are numbers across the world, so encompassing the developed and the developing world. I know there are a number of other factors that have played a significant role here, like economic factors, so household income, or social factors like hygiene. The flip side of the coin is that the cost, the expenditure for healthcare has dramatically increased. It is now between 5 or more likely 10 to 15%, and if the current trends continue, they will reach 20 to 40% of GDP by 2050. And that is not only a problem of the developed world. These numbers are true for the high-income countries, the middle-income countries, and the low-income countries. Let me quickly address the 3 myths that I talked about. Myth number 1, more money spent on healthcare delivers better outcomes. The fact is that we see tremendous differences in healthcare spend and quality of care from country to country. Let me take one example, diabetes. While the US spends about 2 times more per diabetic person, the outcome measured in quality of life of these patients is twice as good in the United Kingdom than in the United States. So if anything, it's an inverse correlation between spend and quality. The same is true within states. So if we compare the quality of healthcare and the money spent for healthcare within the United States, you can see that for about $6,000 spent per average patient in Medicare, you can be among the 10 best states, but you can also be among the 10 worst states in the United States. Though therefore, absolutely no correlation, if any, a negative correlation between spend and healthcare outcome. Myth number 2, chronic diseases are only a problem for the developed countries and not for the developing world. Reality is that while chronic diseases such as cardiovascular diseases, such as cancer, respiratory diseases, are responsible for 2/3 of the deaths globally today, 80% of these deaths happen in low and middle income countries. So it is not at all a problem of the developed world. It is more and increasingly so a problem of the developing world, which needs to be addressed urgently. Myth number 3, we can do nothing to stop this. The fact is that globally about 25 million deaths could be prevented annually if we would just be successful in managing a low number of risk factors. All these risk factors actually have to do with our lifestyle. It is the use of tobacco, for example, which is responsible for about 5 million deaths. It's alcohol consumption, responsible for about 2 million deaths. It is high blood pressure, it's high cholesterol, all things, states of disease that can be currently treated very well if we only are serious about it. So if we look at this, we have to ask ourselves, have we been measuring the right things? Typically, today, we measure 2 things. We measure input, so the spend per capita, or beds per 1,000 people, or physicians per 1,000 people, and we measure the prevalence of diseases, so the disease per 1,000 people. This all says absolutely nothing about the quality or the efficacy of our healthcare systems. I would therefore strongly recommend that we amend these metrics and we start to measure outcomes, so the quality of our healthcare systems and the cost to produce these outcomes. This, I would propose, needs to be done at the level of the individual disease to be meaningful. If we do that, what we see today is quite surprising. If I come back to my example of the treatment of diabetes in different countries, what we can see is that if we take the numbers at the level of the disease, that the United Kingdom is about 5 times more productive or more efficient than the United States in treating diabetes. This is one example. If I take another one, COPD, which is a chronic lung disease, the example is even more striking. Looking at these numbers, France is about 23 times as efficient as the United States in treating this disease. These are 2 examples of 2 diseases. I could propose several others to you. I think what it says is that we definitely need to change the way we look at healthcare and the provision of healthcare so that we have a better view of how the quality of our systems is today. Now, what does this mean with respect to the questions that I raised at the beginning of my intervention? I think realistically, health and healthcare will always be a matter of the sovereign state. There are good reasons for that. It's the history, it's the cultural expectation, it's the prevalence of diseases in different countries, and in a certain way, it's even the raison d'être of the sovereign state to make sure that its citizens are secure and healthy. Nevertheless, there is a role for global institutions such as the WHO. It could be 2. Defining global health priorities and measuring progress against them. For example, as the United Nations have done in the UN Millennium Development Goals. And number 2, measuring and also disclosing, creating transparency on the right data on health outcomes and the cost to deliver these outcomes. Again, an example could be the Global Reporting Initiative of the United Nations. I think this would be the role that the multinational organizations can play. I do not see a role in true global health governance. Thank you very much.